Hi, Dr. Friends. Welcome to my YouTube channel, PG Doctors Indranju. This is most commonly all previous year asked question in the NEET PG DNB and AIIMS PG. This is the collection of all radiological subjects. So it is most important, and due to the pattern of the exam, it is assumed the radiology cover approx to 8 question which you can resolve. So let us start. But I want to say, please watch this video till last. So start with most commonly dissected artery following arteriography by femoral root. It is the inferior mesenteric artery, and the question also arises that inferior mesenteric artery, which level of the vertebra? It is L3 lower border. Here, next one is the used in the diagnosis of protein losing enteropathy. It is technetium albumin, technetium dextrin, and the intransferrin. Next is the pure beta emitters are the yttrium 90, strontium 90, and the phosphorus 32. It is the beta emitters. Central dot sign is seen in the Carroll disease. The trick is here. C stands for the central dot sign and C stands for the Carroll disease. Next one is the radiological feature of the LVHF are the increased flow in the upper lobe vein, curly V line, and the cardiomegaly. Here the next one is the radiation exposure is the least among the option. That means radiation is exposure. Then the option will be mixture cystoerythrogram. Most sensitive imaging for breast carcinoma DCIS is the MRI. Okay, always remember that the sensitive imaging of the breast carcinoma will be MRI. And next is a 20-year-old female patient with 6th cranial nerve palsy untituated MRI show hyperintense lesion in the cavernous sinus showing homogeneous contrast enhancement. Here the most important thing is female patient 6th cranial nerve and hyperintense lesion in the cavernous sinus. So homogeneous contrast. Also the most probable answer goes towards the schwannoma. Ultrasound feature of thyroid nodule suggestive of malignancy. Here hypoechogenicity, non-homogeneous, and microcalcification. Okay, next investigation of choice for the lesion of the temporal bone, that means the hard substance which will be the diagnosis. It is CT scan. Next is CT scan is actually nothing. It is a variety of X-ray. So X-ray is used for the hard substances, and CT scan also. Here they given the option that the temporal bone. So all bone maximum investigation choice CT scan or X-ray, but here the temporal bone, which are the CT scan. The structure causing posterior impression on the barium swallow is aberrant right subclavian artery. Rib notching is seen in So you have to remember this all cases: aortic disruption, Blalock Townsend, and the pulmonary atresia with large BST. Next is the child presented with respiratory distress. Investigation of the choice for suspected vascular ring will be MRI. Next one is the radiation-induced necrosis can be diagnosed by PET scan. Radiation-induced necrosis, so it will be the PET. Element absolute in the radiotherapy, that means absolute in the radiotherapy will be the radium 226. True regarding scurvy, that means the bowing of the leg. So also option will be given or question will be asked: the bowing of the leg is found in the which? So scurvy. Next one, the stereotactic reduced surgery used, that means uses proton, linear accelerator, and the gamma knife. Here all options you have to retain, maybe anyone given or accept. Next one is the C1 and C2 can be best visualized by C1 and C2, that means the upper part, that means cervical bone, first and second, and second C2 have odontoid process, so you have to remember odontoid view. Okay. Next one is the CT or Hounsfield number depends upon the mass density. In the you have to remember also that the Hounsfield number used or Hounsfield unit, this all are for CT scan detail. CT scan discovered by the Hounsfield. Radiological finding of renal papillary necrosis on excretory urogumor. Here the track and horn from the calyces, ring, shadow, and egg in cup appearance is the renal papillary necrosis. It is the radiological finding. Next one is the cerebral blood flow in an asphyxiated child is best measured by. Here you have to remember NEERS. Okay, NEERS. So NEERS you can remember by neonate. Okay, neonate for the cerebral blood flow. And next trick is NEER, NEER. NEER, that means pani, or need, that means indicate liquid thing, so indicate blood flow. Good standard investigation for recurrent GIST is PET scan. GIST PET. Earliest detectable congenital malformation by USG is anencephaly. Here the question always in favor of your answer. That means earliest detectable congenital malformation will be anencephaly. Absolute contraindication of MRI. That means when in which patient MRI will not be used is if pacemaker are on the pacemaker patient. Next one is the most chemo-resistant tumor among the following. That means chemo-resistant tumor. It is the malignant fibrous histiocytoma. PACS in the medical imaging stand for, that means picture archiving and communicating system. Next one is snowman appearance in X-ray is seen in TAPVC. If the right cardiac slot is obliterated, it means the pathology involves right middle lobe. That means right middle lobe. Due to here the option goes right cardiac slot obliterated. That means right middle lobe. I will not detail it here. I will be upload the video of the radiology for such. Next one is the egg on side appearance, seen in uncorrected TGA. Here the investigation of choice for acoustic neuroma. Acoustic neuroma, always remember MR with contrast. Sign of increased intracranial tension. Here sign will be erosion of the dorsum cella, sutural diastasis and the copper beaten appearance. Here mnemonics for increased intracranial tension is DEC, diethyl carbamazepine. So D stand for the diastasis, E stand for the erosion of the dorsum celi, and C stand for the copper beaten appearance. Next one is the hair on appearance is seen in the thalassemia. Floating water lily sign is seen in hydrated cyst. Hampton's hump is seen in chest X-ray in the pulmonary embolism, and least radiosensitivity tumor is osteosarcoma. Investigation not done in case of pheochromocytoma. That means in the pheochromocytoma, which test will not be done, will be an FNAC. The most common hormone deficiency seen after intracranial radiation therapy. That means growth hormone. Next one is the spongy appearance with central sunburst calcification is seen in the serous cyst adenoma. In the basal ganglia, calcification is seen in the metformin dehydration and the renal failure. That means calcification for the basal ganglia responsible will be metformin dehydration and the renal failure. Isotopes used in the RAI iodine 123. Bone scan of the patient with multiple myeloma so called a spot. The most sensitive radiological indicator for the aneuploid is the nickel translucency. Next, differential diagnosis of a spinal cord edema on MRI will be myelomalacia. The mammography feature suggestive of malignancy. The features of such is area of speculated microcalcification. Always remember that in mammography if the calcification will occur, then it should be microcalcification which suggests the malignancy, and the macrocalcification suggestive of the benign. Extraaxial dural based enhancing tumor on the MRI in a female patient of the 40-year age presenting with the recurrent headaches. Diagnosis is meningioma. Plethoric lung field are seen in plethoric lung. You have to remember AST, VST, and TAPBC. Next is investigation choice for the posterior urethra is widening cystogram. Next one is the intensity modulated radiation is used in prostate cancer. Radioactive isotope used in for brachytherapy. Here the cobalt 60, iodine 125 and iridium 192 is used in the brachytherapy, but most commonly used is cobalt 60. Solitary hypoeagulation of the liver without septate or debris is most likely to be the simple cyst. The investigation of choice for the recent onset severe pain in the right hip in the 40-year-old lady on long-term steroid MRI and long-stent therapy is MRI. Haberden nodules are found in deep interphalangeal joint in the osteoarthritis. Haberden nodule. Next is the investigation of choice for the detection and the characterization of ILD is HRCT. Most common cause of mixed cystic and solid supraciliar mass seen on cranial MRI scan of 8-year-old child will be craniopharyngioma. Most common cause of sclerotic skeletal metastasis in a female is breast carcinoma. Most radiosensitive tumor among the following will be the Ewing sarcoma, already melt like snow. Investigation of choice for the differentiating recurrence of breast tumor from radiation-induced necrosis will be the PET scar. Here the next is therapeutic mode commonly employed in intraoperative radiotherapy will be electron. Next is radiation therapy to hypoxic tissue may be potentiated by metronidazole. Stereotactic radiosurgery is a form of radiotherapy. Investigation of choice for the extra-adrenal pheochromocytoma is MRI. Radiolucent stone are radiolucent will be allopurinol, orotic acid and xanthine stone are radiolucent stone. Ray used for treatment of the deep-seated tumor. Here the ray for the deep-seated tumor will be X-rays and gamma rays. Vessels evaluated first in angiography for massive recurrent hemoptysis. In a patient of tuberculosis is bronchial artery. Here the bronchial artery you have to remember mostly. Single 2 centimeter space occupying lesion of the mixed echogenicity on the right lobe of liver on the USG is found in the 20-year-old man. Next investigation is the here hepatic scintigraphy aspects. X-ray is produced when electron beam strike the anode. HRCT, a special CT technique, greater detail utilizes bone algorithm for the image restitution. Differential diagnosis of anterior mediastinal mass is lymphoma, teratoma, and thymoma. Most radiosensitive phase of the cell cycle will be G2. Dense persistent nephrogram may be seen in acute ureteral obstruction, dehydration, and systemic hypertension. The most recent advance in non-invasive cardiac output monitoring is use of electrical impedance cardiograph technique. Radio opaque shadow with air fluid level in the chest along with hemivertebra of the sixth thoracic vertebra on plain X-ray. In a newborn, most likely cause is the congenital diaphragmatic hernia. Earliest X-ray feature of the childhood leukemia, radiolucent transverse metaphysical bands. Container sheet of wire mesh of the copper to shield the EEG cabinet. Here the EEG cabinet to avoid picking up the noise from the external electromagnetic disturbance is called Faraday's cage. Faraday's cage. Attenuation value of the zero Hounsfield unit in the CT scan corresponding to water. The piezoelectric crystal technique is used for ultrasonography. Most common organ involved in the bronchogenic carcinoma will be adrenal. Most common organ. Investigation of the choice for evaluation of the abdominal trauma will be CT scan. The investigation of the choice for imaging of urinary tract tuberculosis will be CT scan. Radiation dose for the pain relief in the bone metastasis is 30 Ga in the 10 fractions. Maximum permissible dose for the radiation in the pregnancy will be 0.5 rad. X-ray feature of mitral stenosis is double atrial shadow, lifting up of left bronchus and posterior displacement of esophagus on the barium swallow. This question asked in the different way. First, direct like that, and double atrial shadow seen in lifting of left bronchus and the posterior displacement of the esophagus in the barium swallow. This has various type of the question which are asked in the PG exam. Next one is the best next investigation in the patient with solitary pulmonary nodule on X-ray will be the CT scan. Egg cell calcification seen in the silicosis. It is the most common answer. The basal exudate infarct and the hydrocephalus on the CT are seen in the tubercular meningitis. Next is the wide neural foramina is associated with neurofibromatosis. Next is the hyperechoic hepatic metastasis on the USG are seen in the mucinous cyst adenoma. Next is a patient present with raised gesture and ataxia and the MRI well demarcated cystic lesion with a mural nodule in the cerebellum. The diagnosis is hemangioblastoma. A 40-year-old female patient with recurrent headache, MRI extra axial dural based enhancing lesion, diagnosis is meningioma. The gold standard test for measuring bone density will be DEXA scan. True about MRI. Contraindicated in patient with the pacemaker. Always remember the pacemaker, if you used by patient, then MRI can't be done. Use for localize a small lesion in the brain. Useful for evaluating bone marrow. Long-term effect of the radiotherapy for the CNS tumor in the children will reduce IQ and learning, intracranial dysfunction and musculoskeletal problem. True about contrast in the radiography. Here the ionic monomer
have 3 iodine atom per 2 particles in the solution. Here the 3 iodine atom, 2 particles in the solution. The contrast agent preferred in the patient with decreased renal function to avoid contrast nephropathy, low osmolar contrast. Consolidation of the part of lung obliterating the aortic knuckle on X-ray chest is left upper lobe, posterior part. Next one is the objective sign of pulmonary plethora in X-ray chest is diameter of descending right pulmonary artery more than 16 millimeter. Best investigation for bone metastasis is the bone scan. CT scan. Least accurate in the diagnosis is gallstone. Here you have to remember gallstone and kidney stone. Kidney stone. The 80 to 90% of the gallstone are radiolucent. That means for such gallstone, USG is the investigation of choice, while that of kidney stone, then kidney stone as 80 to 90% kidney stone are radio opaque. So here the X-ray will be or CT scan will be the investigation of choice for the kidney stone. Next one is the walls of CT scanner room are coated with lead. The major difference between the X-ray and light, the difference of both are here the energy. Most imaging radiation is the alpha. Background radiation is radiation present constantly from the natural source, which best estimates the amount of radiation delivered to an organ in the radiation field is absorbed dose. Next one is the stochastic effect of the radiation is probability of effect is a function of dose. You have to read in word probability of effect is a function of the dose. Agon side appearance in TGA. True about CT scan features of the adrenal is adenoma, calcification is rare, and low attenuation and regular margin. It is the feature of the adrenal. A dense renogram is obtained by repeat bolus injection of the dye. Pruning of pulmonary artery is seen in pulmonary hypertension. Test of choice for reversible myocardial ischemia is the thallium scan. Test of choice. Preoperative test necessary in the Down syndrome patient before surgery is the echocardiography. Due to Down syndrome, the most common is the cushion defect. Amifostine protect salivary gland, kidney and GIT. Here the focal and diffuse thickening of the gallbladder wall with high amplitude reflection and comet tail artifact. Here the comet tail artifact on the USG suggests diagnosis of adenomyocytes. Next one is the MRI feature of mesial temporal sclerosis is the atrophy of mammillary body. MRI feature of mesial temporal sclerosis. Next one is the atrophy of fornix and the atrophy of hippocampus. Okay. Here the photoelectric effect can best described as an interaction between the low energy incidence photon in the inner cell electron. Allergic reaction to the radiological contrast agent is the anaphylactic reaction. Uses to measure GFR 9M DTPA. DTPA is mostly used. Flaring of anterior end of ribs is characteristically seen in the rickets. Next is inferior rib notching is seen in the coarctation of the aorta. Earliest radiological sign of pulmonary hypertension in the chest X-ray is the cephalization of pulmonary vascularity. Earliest sign of left atrial enlargement. Left atrial enlargement is posterior displacement of esophagus. Okay. Most common feature of aortitis on chest X-ray, calcification of ascending aorta. Investigation of choice for detection and characterization of interstitial lung disease is HRCT. Maximum ionization potential in the helium. Here the radioisotopes used as systemic radionuclide is P32, SR89 and samarium 153, strontium 89, P32. P32 emits beta ray. Treatment to differentiate thyroid cancer will be iodine 131. Non-ionizing radiation used by MRI, thermography and ultrasonography. It is most commonly asked question. Next one is imaging technique that gives maximum radiation exposure to the patient will be CT scan. Radiotherapy for Wilms tumor after surgery is done within the 10 days. Radiosensitive tumor will be dysgerminoma. Rib notching on chest radiation caused by the coarctation of aorta. Objective sign of pulmonary plethora in the chest. Here the diameter of descending right pulmonary artery more than 16 millimeter. Investigation of choice for evaluation of an aneurysm is arteriography. The imaging test most sensitive for early renal tuberculosis is intravenous urography. Assessment of ventricular function is most accurately done by echocardiography. The most important sign of renal artery stenosis on angiogram is the presence of collaterals. The MRI show lesion in the multiple sclerosis is the white matter. The investigation of choice for the vestibular schwannoma is the gadolinium enhanced MRI. Radiological sign of the scurvy are the Frankel's line, pelican spur, zone of demarcation near epiphysis is the radiological sign of the scurvy. Next is widened duodenal C-loop with irregular mucosal pattern on the barium meal suggestive of carcinoma of head of pancreas due to duodenum and head of pancreas here the like that. So if grow in size here it will force like that so that it is C like loop. Next one is the most penetration beam among the following is 80 millivolt photon. Radiation tolerance of whole liver is 40 K. Postoperative radiotherapy is used in the colon cancer, head, neck cancer, soft tissue sarcoma. CT scan feature of acute pancreatitis is ill-defined outline of the pancreas, enlargement of the pancreas, and poor contrast enhancement. Here the classical CT finding of the acute subdural hematoma is the crescent-shaped hyperdense lesion. The first investigation in case of suspected subarachnoid hemorrhage is NCCT. Radioisotopes are used in mass spectroscopy (RIA) and sequencing of nucleic acid. Technique in the radiotherapy to counteract the effect of tumor motion due to breaking is called gating. The gold standard for the diagnosis of the osteoporosis is dual energy X-ray absorptiometry. The most sensitive investigation for diagnosis of the ureteric stone in patient with the acute colic will be NCCT of the abdomen. Okay. Next one is the ultrasound. Marker with increased risk for the Down syndrome in the fetus is the nickel edema. The most preferred route for cerebral angiography is the transfemoral route. The tumor showing calcification on the CT scan is meningioma. Nuclear medicine. Gamma camera is used in measuring the radioactivity. Most useful radiopharmaceutical for bone imaging is the 99 technetium MDP. Radioisotopes used as permanent implant. Permanent implant is gold 198, iodine 125, and the palladium 103. The most penetrating power in the gamma X-ray. The contrast for proper radiographic image in a heavy built person is increased milliampere. Acute respiratory distress with hyperinflation of the unilateral lung in the chest X-ray in a 2-year-old child is suggestive of the foreign body aspiration. Here the solid well circumscribed hypoechoic renal mass on USG abdomen in the 3-year-old boy is suggestive of Worm's tumor. X-ray feature of the Pintberg tumor is the driven snow appearance. Craniospinal irradiation is used in treatment of medulloblastoma, and prophylloacetic cranial irradiation is indicated in the small cell carcinoma of lung and ALL and NHL. Epiphyseal dysgenesis is found in the hypothyroidism. HRCT of the chest is the investigation of choice for the interstitial lung disease. Recognized X-ray feature of rheumatoid arthritis is bone erosion. Next one is the extensive pleural thickening and calcification of the diaphragmatic pleura are features of asbestosis. Biconvex hyperdense lesion displacing gray-white matter interface on CT scan of the head injury patient suggested extradural hematoma. Imaging investigation of choice for the posterior fossa tumor is the MRI. Hyperthyroidism can be treated by iodine 131. Radioisotopes commonly used in the external beam radiotherapy in the treatment of cancer patient is cobalt. Thanks friends for patience. Have a nice day. I will upload the all the questions which are asked in the previous uh, year of the NEET PG and approx to 10 year of the question which are one liner. I will upload such video for your nearby exam. Thanks again. Have a nice day.